Hello, I'm Dr. Blaise Bourgeois.
Dr. Jonathan Chetzel.
Today we're talking about direct access.
All right, specifically we're talking about what is direct access. Direct access, related to us physiotherapists here in Texas, is just your ability to come into our office, get evaluated for whatever might be bothering you, and then get treatment for that so you can get back to doing what you're doing and, get out of pain or whatever it might be.
So what does it mean right now that you don't have direct access? So how do you see your physiotherapist?
Oh, my turn.
Yeah, tell me.
Yeah.
So how, explain it to me. So, people,
So right now,
people want to know how do you, what does it mean direct access? Why can't I just go see my physiotherapist right now, or can I?
Yeah. So it's like a yes and no, and it's like, yes, you can come see us, but right now the way it works is you can come see us and you can get evaluated. So we can do some things, figure out what's going on, tell you how we can fix it. But the real sticky part is we can't actually do the treatment to help you get better.
Right.
I said fix it earlier, that's not what I mean. So right now it's kind of as in, you can come see us, get evaluated, but we can't do the treatment without some type of overriding referral or prescription for physiotherapists. So you're having to go see your medical doctor, you're having to go see your chiropractor, you're having to even see like a dentist, an optometrist, pretty much any other doctoral program healthcare professional is having to write this prescription in order for you to get in our door and allow us to legally perform treatment that you desperately need that day.
Right. And I think one thing that's important to mention, because you'll hear other people, maybe other practitioners saying, well, we have direct access. There's I want to say 48 out of 50 states now claim they have direct access. And they have that, as the title, but it's not truly direct access. They'll call direct access the ability to go in and see a physiotherapist for an initial evaluation, but we can't do any treatment. You still have to go back and get a referral before we can actually treat you to get you feeling better and moving around better. So you got to be careful with that.
Yeah, and here in Texas, we're not even that fortunate. We don't even have what Blaise is kind of describing as limited direct access. We have none whatsoever. Coming up in 2019, we're going to have another vote on that, and we're going to kind of use 2018 to produce content to show you how we can help, why we can help, and why we should be able to see you and treat you according to what you're going through.
Speaking of, what does direct access mean? Why is it so important? We talked about trying to get in, but what are you saving by being able to go see your physiotherapist? You're saving that moolah, that money. I mean, it's going to cost money to go see these other providers that he just mentioned, just to say, hey, I woke up wrong. I got this neck pain that's been bothering me for a few days. I know my physiotherapist can help me, but I need to go see you before I can go see him. And it costs money. It costs money to get to the doctor, and it costs money because of time. You got to take off of work. And how long does it take you to get into that doctor's appointment? If you call on a Monday, are you going to be able to get in Monday afternoon or Tuesday, or is it going to be a few days
week
before you get in? It may be a week.
So how long are you going to sit in that office, Blaise?
You can sit in the office for a few hours, You might be there for 2 or 3 hours to walk in for 2-3 minutes. Or the doctor say, hey, you got neck pain, you want to see physiotherapy? Yeah, look, here, take the paper. I mean...
And, we're kind of really going for it here, but at the end of the day, sometimes, those visits are needed. But just given that most people that are going through some type of discomfort, limitation, pain, what it may be, they're able to see a lot of other healthcare practitioners, some of which that aren't spending enough time with the patient, some of which aren't qualified to actually help the patient. And all we're looking to do this year is convey why we should be on that same playing field, and to kind of give the choice to you, to the people that are watching this, the people that need the help. The choice should be yours, and we hope that when the next time 2019 comes around, that choice will be yours.
And that's the big question. So how do we get there? What is it that we need to do to get direct access? And that's something that we're gonna hopefully focus on, throughout the year as these important time periods, show up on us. We'll kind of focus on what things we can do, whether it's calling our legislatures or showing up to hearings or meetings or whatever it is.
So if you have any questions for us or any comments, or if you're looking to kind of collaborate and work together and as this next year goes on until that point in time comes, just reach out to us. We'd be happy to work with you and happy to collaborate.